everybody. Once again, welcome to my channel, and my name is Dr. Ogbe Edward Monoyer. On this series, we tell medical stories where we help medical students, doctors, healthcare professionals make sound health care and career decisions. Today, I have an amazing doctor all the way from the gold city of Ghana. So welcome, Dr. Ebenezer Aheto, everybody. All right.
Thank you.
All right.
Thank
So
you,
would you love
everyone.
would you love to introduce yourself?
Okay, so good evening to everyone, and I'm privileged to be here. So I'm Dr. Ebenezer Aheto, currently house officer at 37 Military Hospital, one of the biggest hospitals in Ghana, located in the Accra, the capital. Currently having my pediatric rotation, already done with surgical rotation. Yeah, so that is it.
Wow, great. I guess there are 4 rotations, right? So you have
Yes.
probably
Yes.
internal medicine and
we have internal
obs and
medicine,
gyne.
obs and gyne too.
Oh, that's great. I heard in Ghana probably the surgery is the toughest. Maybe everywhere, I think, in some certain way.
Yeah, that is right. And then I think how tough is it depends on also the facility where you find yourselves. Depends on the number of cases. 37 Military Hospital is the National Disaster Hospital. So most of the complicated and let me say the mass casualty cases comes there. And of course, that will definitely put you on your toes. So the workload is extremely high as compared to the most of the other facilities, even though we have the Korle-Bu Teaching Hospital, which is the biggest, also doing the most, but because we are the national disaster hospitals, and we have most of the orthopedic surgeons, the workload is really high over there. When we're doing the surgical rotations, like you don't have life. That
one. but I think the good part of the workload is that you also get experience more than anyone who is having it easy. Yeah.
So. Oh yeah, sure. You see, there's a way you can get so worn out to the point that you just have to, it's like you're working like a robot. You're just doing it because you have to get the job done. And I think when we go deeper, I would like to highlight on how you still get your passion, going, and then your zeal not be worn out amidst the pressure and everything. Yeah. Because
wow, great.
that one too is there.
All right, guys. So you have heard that this discussion is going to be going very deep. So you have to watch this video to the end, especially if you're in Ghana or you're interested in the medical field in Africa or just in general to get the information. So, all right, Dr. Eben, like I love to call you Eben. I'm not going to go Ebenezer all those long part today. So I always love to throw all the doctors under the bus by trying to ask them this one question before we go to any topic we're talking about. Why did you decide to study medicine?
Okay, so thank you very much for this question. I must say that this is actually a personal choice because
although your dad is a doctor.
Yes,
right?
Yes, this is a personal choice, and I must say that even though my dad is also in the same field, and some people think that my dad has pushed me to, also enter the same field, but we all know very well that one, if you don't even make the good grades, it's almost like we're not qualified to study the course. So it's highly competitive course, and before one can decide to go into, you should be ready to make the good grades. That one too is there. So it was a personal decision. Growing up, I've stayed almost in the hospital bungalows for so many years, and I was scared of the environment and everything. But I still saw it very amazing how somebody bleeding all of a sudden, the person has been discharged and they carry their bags and they are going home. It was also amazing. I was like, if there's something like this that somebody can do, why not that instead of any other thing? So to me, from basic school, it was either medicine or nothing. If you ask me of any other thing that I would like to do, it's either medicine or nothing. I said there was one time that I said that it's either I'll be a medical doctor or I'll be a pastor. Yeah, so it was just one of those things.
But the two of them can work together. I eventually was able to get my medical degree, and I don't know, found my way to becoming a pastor as well. Can I say find my way? I don't know how. Well, according to God's will, let's just let it there. Okay, well done, well done. I admire your strong passion for medicine, and I can attest to the fact that I know that you love to be a doctor. So that's why I'm really interested in interviewing you, because it's really good to be able to get a lot of information from someone who is so passionate about the field and not to find themselves there. So today, in general, we just want to be able to help young medical students, and let's say starting from their first year to the final year. What are the things that you think that they need to know or they need to be doing right now? Looking like having your young days in practicing, doing your house job right now. So what were the things that you wish that you did better, or that you were happy you did? Because not everybody just breeze through. So maybe in points, and if I have any questions as we're going, we'll just go that way. Yeah.
Okay. So this question seems, very broad. It's a question that you may think you have so much things to talk about, but if we narrowed it down, you'd be like, what exactly did I even wish I would have, done better whilst I was in medical school or something like that. But let me make this emphatically clear that one of the things I decided to do, and as of now I don't regret, is decided to actually serve God the way I did whilst I was in medical school. And
Mm-hmm.
I'm not saying this because maybe I'm speaking to a Christian section, because I don't know. This interview is basically made for everyone. So, but I'm speaking as a
Mm-hmm.
religious person, being in the Christian
Mm-hmm.
field, and I can bet you that sometimes I keep asking myself, when I was in surgery for 6 months, I had not attended church, and it's
Mm-hmm.
not something that I'm happy to actually talk about. Somebody will say that, and when I complain, they'll be like, in fact, one day my boss was like, even when I was a resident, I never attended church. You have to say I want to go to church, that kind of thing. Nobody actually understand the way I was feeling. The guilt
Mm-hmm.
of not. Sunday and we're at work. Sometimes you be at work on Sunday to Monday, even to Tuesday before you go home, and somebody will be
Mm-hmm.
like, "Hey, so you didn't go to church? Do you even go to church?" And it's like they are classifying you as, you know, not the church
Sinner.
kind, but only you know where you are coming from and where you actually wish to be. But the work
Mm-hmm.
was not allowing, and that is a duty call. And
Mm-hmm.
that's and it's actually reminds me of the Bible when it says that we should make most of our youthful ages. I would say
Mm-hmm.
that I'm out of the youthful age, but it's almost
Mm-hmm.
like I'm living the youthful age. And
Mm-hmm.
everything actually explains itself. Here comes a time when I was in medical school. Go to church whenever I have to go, be there for
Mm-hmm.
meetings, go for evangelism, everything, and
Mm-hmm.
there's no pressure. It's like I have the time. I choose,
Mm-hmm.
to do what I want to do with it. And
Mm-hmm.
deciding to serve God was actually the best time. I mean,
Mm-hmm.
because it was a choice. I could have chosen, I could have used that time to do something different, maybe probably be sleeping or maybe be playing football. But I was
Mm-hmm.
happy I told myself to actually know the word of God. And it
Mm-hmm.
doesn't, even though I'm not going to church actively as before because of this
Mm-hmm.
period of my training, but
Mm-hmm.
I'm not at wedded, if I have to put it that way, that
Mm-hmm.
nobody tells me that because you're not going to church, go and read the
Mm-hmm.
word of God. Because you're not going to
Mm-hmm.
church, go and do a quiet time. I don't need
Mm-hmm.
anybody to come and tell me that, because
Mm-hmm.
something in me, because I have to read the word of God to at least try to compensate God that I'm not going to church. I don't know. So that God, this one, it is not my fault that I'm not going to church. I wish I can. But since I can't go, let me pray. Let me do this. Let me do that.
Mm-hmm.
Uh-huh.
Mm-hmm.
And God being so good, I have a colleague who sometimes comes around, and he also, almost in the same situation. As a matter of fact, he was ordained pastor, but also doesn't have
Mm-hmm.
time to go to church and all. And when we meet
Mm-hmm.
and we pray, it's like you can see that we miss Charlie. We mix it, like we miss
Mm-hmm.
that union. We actually miss that, the mass union of worship and everything. So I don't regret.
Mm-hmm.
Yes, because in the field, there are a lot of corruptions, corruptible stuffs are happening. So if you are not groomed from the beginning, like how we did in medical school and everything, trust me, it's very, very difficult for you to be saved, because the pressure is so much for you to be thinking of serving God right. Sometimes you just know that you're actually living the right life and not be thinking of this one day I don't have to do. And I mean, you don't think of decisions as to go this way or go this way. You just find yourself living the right life, because why? That is how you have been living all this while, and that become part of you. So you don't easily deviate. So making the decision to actually know God and know God more is one of the things that if I have time to go back to school again, I don't know if before I gave it 40%, I said that maybe now I'm going to make it 50-50. Yes. Yes. So I don't regret.
I think it's very important. And I think it's very important, this point you just brought, especially as for most of the people who watch my content are actually Christians and doctors. So they have these 2 points together. And this is one of the greatest sacrifices as doctors that we have to make, because of course, there has to be someone in the hospital to treat people on Sundays while things are going. So I think it's a very important point for people to hold on to, because the relationship, and really you're not the first person I've had this conversation with. Most of the people I know during their internship, it's really a struggle, to sustain their spiritual life and, keep the whole balance. So I think it's a very important point for someone to note that in the days of medical school, where you have time and where you have the opportunity to be able to do things, that you build your relationship with God, so that in times like that, you can be able to be sustained. But thank God for things like Zoom, right? And internet connections. Yeah. So I think in those times too, if wherever the church you're worshiping with, you could also go online. I know it's different. It's actually really different from being really around. And even sometimes, even if I know that the nature of the work may not even allow for online, because you can't be treating the patient and be listening to, sermon and all those stuff. So thank you for that point. It was really good. So guys, you've heard Dr. Eben say, take care of your spirit man, so that during the days of internship, you will be doing very well, serving God and also saving humanity. So aside from that, yes.
So that is that. I mean, I can't overemphasize that. If something that I want to encourage anybody to do whilst we're in medical school, Charlie, put God first. I mean, build up yourself. A time is coming. And I didn't see this coming. I know that no matter how crazy it will be, at least I'll still find my. There's a way you go to church and you get reminded of who you are. But here comes the case, you don't get a chance to go at all. So you just realize that you're working very empty. So if we're still in medical school, this is the time. So make most use of it. All right. So the second one I would like to also talk about is get involved in the school. I mean, where you are. You have to actually.
How exactly get involved? Does it mean going to classes, or what do you mean?
Okay, so you see, I've realized that favor comes in multiple ways, and favor actually comes to people who are actually present at the time of need. There are some people, they're in the school, but they're not involved. There are some people, they don't even know that this particular month the school held a very big conference, because there's something about the medical school. It is not forceful. We don't actually force you to do things. So you may think things are not happening, and you realize that a whole lot of things are actually happening. The reason I'm saying that, get yourself involved in a sense that when you start doing your house job and then your rotations, your consultant actually moves with those who are involved. And there's something about getting involved. You get used to. I remember way back in medical school, when we go for, let's say, most times in the internal medicine classes, and we have a patient, we are lucky enough, you can to meet a patient to examine, it's not easy. Lucky enough to meet a patient and you say that, let's go and examine. If I'm behind, they'll push me in front. I don't know why they have to tag me that way. If it is a sample that one have to take, they have to push me in front. It's like, go and do it and get it wrong and let's see how it will go. That kind of thing. You get it?
Yeah.
So you realize that
it.
even when you don't have a class, my teacher can see interesting case and call you if we're around the hospital.
Call you
to come and help you look at it. And trust me, it tells you that the person is actually involved. You get it? So maybe you'll be talking about hepatoma when you have not actually seen physical hepatoma patient and you be called to come and see. And you are there with your colleagues and you may think like, we've got the same information. No, you can never get the same information with someone who gets himself involved. I'm telling you this. Now, when I started surgical rotation, there's something about a house officer that they will tell you that you can get all the theory you need in this world, but to get a hands-on is difficult.
Yeah.
Glory be to God, I did 3 appendectomies in 37 military hospital.
Wow.
And when anybody hears about it, it's almost like, how come? How did you? But I met a senior house officer there, one that I was doing a case with one time. We had a secondary closure to do, and my consultant was like, okay, Dr. Aheto, assist her to do this. She is already living and she has to know how to suture. Deep down in my mind, I was like, oh my God, to suture? Something that if you give it to me, I can close my eyes and just finish it up. But I was just like, okay, sir. And I'm standing there assisting this lady, doesn't even know how to hold the instrument. So should I go this way, go this way? Say, no, do it this way. And the only thing I'm doing is assisting her with dabbing for her, shaking my head that if this man make a mistake and give me this instrument, he will have a shock of his life. But I just stood quietly. And she did it, and she went to finish. My boss was like, so this is how she did it. I said, yes, sir. So, okay, so the next time we have a case, when you are done, when you are done with everything, you close the final layer. I said, okay, sir. So we had a case like that. I think it was, either appendectomy or something like that. And small incision. I was like, okay, so close it. When I heard the forceps and then I took the situation, it was like, wait,
is this your first time?
Doing locum somewhere? I said, oh no, sir.
Meaning like extra jobs, like maybe people go for go
locum,
to like private hospitals and work.
Sneaking to go and be doing some things outside. I said, no, sir. And the anesthetist was like the confidence used to hold the things, like the guys waiting to close sales. And interesting, I see this man always, because you have a lot of cases, closes the simple way, where you just put the stitches, simple interrupted, and just close it. And the guy's a young guy. So I took the skin, I opened it, I was like, what do you want to do? I said, I just want to do subcutaneous. I want to embed the suture. I was like, Charlie, the guy checked like he knows his way around already.
Yeah.
And before you realize, I've done subcutaneous, close the wound where you cannot see the sutures. And he was amazed. He was amazed. So when he finished that, he was like, have I been doing some things? He still wanted to, how house officers, when they come, they only want to come and see, not to touch.
See, yeah.
But
not
I
to
want
touch,
to assess, touch, and even if you allow me, I want to do. But I didn't know how I got all those experience. And from there, whenever sometimes I'll be sleeping, I'm not on duty. He called me that he just got an emergency, maybe a gunshot wound. Can he pick me up and we go? I said, yes, sir. He'll pick me up, you go. When we finish and the day is already break, I continue the work there. I don't go back home. This is what I mean. Get yourself involved. When you get yourself involved, they'll be moving along with you. They'll be moving along with you. And he promised me that. So he was like, so what kind of service have you done? And I said, when I completed medical school, I was in the municipal hospital where you have almost like 2 doctors. And I went there and we are like 3, a locum base. I know my suturing already. Have you done appendectomy? Have you done ectopic pregnancy before? I said, no. I said, okay, this is how we do it. I assisted, we close everything. Second one, I did it. So before I started house job, I've done almost like 3 ectopic pregnancies. For cesarean session, I can't count. A lot of times, because when I got my hands on all those things, they got COVID. All my doctors got COVID. I was the only one tested 5 times, but I never had COVID. So I was the only one working. So the hospital is for you. You do the cases and you'll be like, oh, child, this case can wait tomorrow morning. I'm tired. You know, that kind of thing. And they don't even know that you are yet to start your rotation.
So start your rotation, yeah.
They don't even know. So when you are in the same field, think like these are house officers. Never think you're on the same page. You are come to learn the same thing because you're in the same institution. It's never true. My boss promised me 4 appendectomies. First one, he said first one should do it 15 minutes. I completed in 25 minutes.
Wow.
Because even though I can try to very fast, but I have to put myself like I'm learning, and then try to be very careful so that there won't be any complication for us to solve, and it will be like the house officer did it.
Yeah.
So I was extremely careful. Second one, I tried very, very fast, successful. Third one, successful. Fourth one, I went in, I realized that I was ruptured with adhesions all over. And I called my boss that there are plenty of adhesions. I can see the appendix, but it's embedded. So he came in and then he did it. And I was done with surgery, doing appendectomy. I do amputation with him. I close down. When he finished, he leave everything for me. I ligate all vessels and I close it and do all this things alone. And when they get here that when you are in world rounds, so you guys are here. I thought he's doing appendectomy and crazy things, and you guys are here, you know, that kind of thing. And they'll be like, how come? I'm not there. I'm no more there. But they will tell them that when you're on night duty and you have issues, you get a case, you're calling the boss, and you have a house officer you can call, quiet, or his number is here. You know, that kind of thing. As at the time I was doing surgery, I was the only one who can pass chest tube. Yes, because when I was doing cardiothoracic surgery, I was the only one doing cardiothoracic surgery rotation. And one of my surgical boss was like, he was talking to the cardiothoracic surgeon. So, oh, you see house officer now? Also, this guy is a whole mood. Then you are lucky to have him. The first thing he told me, asked me, do you know how to do a chest tube? I said, no, sir. Give me the indications. I told him what indications I know. We got a case, chest tube. He said, come, let me teach you how to do this thing. Fast. I didn't even know some residents who went there don't even know how to place chest tube. I got a second one.
Wow.
I did it. And it's almost like when you're on night duty and they get emergency and it's a chest tube, it's for me. They have to come and do the chest tube. You see how it is? This is so many procedures that you can't get it so easily. I was likely to get it because that was not the time it's come to teach me the basics. So if you don't get yourself involved, you complete the school, get the same diploma, but never think you got the same knowledge. The knowledge cannot even be the same because we're studying different things, different sources and stuff, even though you pass the same exam. But the hands-on, it will never be the same. So when you get yourself involved, your bosses will move along with you. I'll be there. Dr. Anna Titova will be hosting a class session, and she will need my assistance. She will call me. She's a cardiologist by profession, almost a professor now, doing so many things. And if a professor will call you to come assist me, it tells you how, you don't have to boast. It tells you how good or, how involved you are. You're not the only one in class. You're not the only one group that she's teaching. So why only you? So when you get yourself involved, they move with you. All the in Kotoka International Medical School, all the good teachers you see in all those departments, I have all the recommendation letters. They all gave me recommendation letters that I don't know how it's going to help me, but once we're in this institution, you know that recommendation is very, very key and very necessary.
Yeah, very key.
Every step that you take. So that's why I'm making this point that you really have to get yourself involved once you are there. Yeah.
Wow. It's a very, very, very important point. Really, and I think from the very first go in medical school, I think this should be a point that everyone should take. There's something very important that you said. Everyone can pass the same exams. Everyone can pass through the same classes and through the same lecturer, but everyone did not come out with the same knowledge. It is very important. And remember, the medical world, I want to just borrow from what the previous doctor I interviewed said, you know him, Dr. Ade. So
Yes.
he said, except you just want to answer doctor and you don't want to practice. He uses the word, you just want to catch crews, just add doctor to your name and be fine. Then you can just go through medical school. But if you're having the desire to practice, you need to get hands-on. That's really very that's a key point. I think that everyone should remind themselves every day. There will be that temptation to want to be lazy. I remember those times. Do you want to go home or do you want to go to the to see patients? And you see that if the class was a class of like 12 people, sometimes the whole group will go home. They don't want to go and see patients at all. So and one thing also, especially if you're studying in Ukraine, I don't know, most times the teachers will not push you, they're not pressing, they will not force you to do anything. So don't let that make you become very comfortable. One thing I found out that, like you were saying about teachers, if you begin to push and get involved, like you said, they will open up and even show you more things. So that's a really important point. Wow. I can't wait for the next one. The first and the 2 points are really good. So next.
Okay. So next, let me just talk about try to also do a research presentations. These things really, don't be a medical student who is so unperturbed about whatever is going on. It's very important. More times we host a presentation of cases. You present your cases to your bosses, and sometimes you stand there to win their love. You stand out to actually win their hate or hatred, if I should put it that way. Yes. You are seeing a patient. You can't present the patient to your boss because you don't even know how to collect a good information. You don't even know how to, gather the information, and don't even know how to summarize the information to your bosses. You see, one thing they don't like is that when you summarize a case for them and you leave a key point out and they realize that you're not achieving so much because you left something. As a house officer, you're almost like the first person to receive the patient.
Yeah.
And almost like what you decide right there depends on the steps you are going to take. Because it's all more like an emergency. That is how it is. So you see, so if you mess up from the beginning, it follows.
Yeah.
So collecting of data.
And if I can shift something, I'm so sorry to interrupt you. There's something that probably if most people that may watch this at instant go, or maybe when you study abroad, especially in Eastern Europe, Ukraine, you see that they made us do a lot of history taking. But I don't think many people quite understood the reason why. To be honest, it got to the end of medical school before I really began to grasp like, oh, this is not for you to just go and copy case history, sometimes and all those stuffs. And let's not even go there, you just go and type somewhere, copy something, just write.
Of your own point.
Yeah. No, but that's why we are advising, and that's why we're trying, and that's the reason for this series, to help people. And because it's different if you're actually, I think one of the doctors that was here he said it's different when you go back to Africa, because in other parts of the world they may have more equipments that and more test procedures that may make handling a case easier. But back in Africa, we depend on all of the questioning, all of the observation, because we don't really have enough imagery or all of those important stuff that may be necessary to give clear diagnosis. So don't copy case history. Try as much as possible to understand and learn. So over to you. I just wanted to put that in there.
Yes, and then going forward, you'll be taking a lot of data for mortality meetings, for morbidity meetings. Yes, because we work with house officers are there, residents are there, and then your consultants are there. Of course, you don't expect your consultant to come and gather all those informations. That one will be left for you, and your resident won't do that, even though the resident is going to answer to the consultant, and you are going to answer to the resident. So you will be collecting the data. I mean, I just completed one that is mortality and morbidity data for last month, and that was pedics. And there's a lot of patients. And I was so unfortunate that as my unit, the pediatric emergency, and almost like I'm the senior house officer there now. So I got a new house officers who came, and they cannot, they don't even know how things are going there. And everything was on me. Previously, they would collect the data and share among themselves, and I was the only one. And it wasn't easy. Some units, like the pediatrics, OPD, their presentations, they didn't almost don't know how to go about it, make some shabby presentations. It was rejected. And I was the only one. And it was so stressful to the point because I have to come, work, seeing cases, so gather that information, move to all the statistical places in the hospital to make sure my information is on point, finish and then do a PDF, do summaries for all the mortalities, what we did for them, the number of days they stayed, every single day, what was happening. So as I was saying, it was so much work that I have to do at the same time. I stayed all night, maybe I will sleep around 3, and the next morning, 6:30, I have to be at work. So it is simple collect. That was the first time I was like, hey, so collecting data, this is how this thing is actually is. So if we have not participated in collecting data, participated in research work, participated in presenting a case, and you don't present to your colleagues, you're presenting to consultants, I mean fellows with the fields that you are doing. You get it? And everybody's listening to you. And yes, they know that you're a house officer. But when it comes to presentation, they expect some form of professionalism, perfection. You get it? So all these things are something that could have been done in medical school. Your research works, they are all there. I did the research with infectious disease, is it Budnenko or something like that? I've forgotten his name. Yeah, I think a name like that. I did the research work with him. I was here one time, I saw a copy. It was sent me a shot of our research work. It was on TV and everything. You get yourself involved in all those kinds of things. I remember when he was giving me different sites to read here, Germany, translate it, and I'll be reading to see, gather all the cohorts and everything. So it starts from school. If you don't know how to do them, when you come practically, you'll be worn out.
Yeah.
And when you are good, it follows you. It follows you.
It's really true what you're saying. I wish really, like I said, that's one reason why I'm still doing this series, to help people, because many times now, maybe when I want to apply for one or two things, I just thank God that I was able to get one or two research work done. And I just want to put that point that it is like the other previous point you said, when you are hands-on and actively involved, that is really when these teachers will get you involved in their research work. The few ones I did, you won't even know they are available sometimes if you're not really hands-on with them in class, doing your best, and not just being a good student or getting marks, like really interested in knowing that the medical craft and everything and how it goes. They will give you work, and sometimes really it's not about marks, because some of these things may not translate into your general marks. Sometimes they do, sometimes they don't, because sometimes you may even just get involved in just translation and doing all those things. But at the end of the day, you are learning how to write papers, you are learning how to present, like all those things. So it's really very important. I just wanted to connect those 2 points together, that it may be shocking for someone to know that you were able to do research work. I can really relate with you, because even sometimes when I Google my name right now on Google, some of the things that comes out is the research work I did with some teachers, apart from that. So when I'm applying, sometimes now, then I didn't even know, I didn't have this knowledge. So when I'm applying now, I just copy the link of the research work where it was something that, like, my name was done in this paper, so I have done this research and this research and this research. So it makes a whole lot of sense. Like, really, it's really good. It's a very good point. Yeah.
So I think, just as doctor just added, I mean, that is it. So try to do all those things. Please just do some. Okay. Research work is something that is very bizarre when we start. But you finish, and then you always love it. You always enjoy it. Yeah. I remember when I finished, and it goes into our data that mortality and mobility data for pediatric emergency 37 military hospital month of May presented and done by Dr. Ebenezer Aheto, Practice officer. I feel very proud of myself that I got myself and then I did something like that. Yeah. Now,
amazing.
Last but not the least, let me just add up to that. In medical school, make friends and a good friends.
Yes.
You just make friends and make a good friends. Friends that you can always be moving along. Friends that can actually help you in times of need. You get it? Not friends that after medical school, you guys part ways and there's nothing to write home about. I'm saying this because, I mean, I have a very good friend of mine that if I should mention it, most of you know him. I started a rotation before him, came to the test
Dr. Swiss. I will not call his name, I'll just say Dr. Swiss. Head of the Canadian group. Are you even part of that group?
Yeah, the Canadian brothers, you know. And
okay, yeah.
It is almost like he doesn't know what is happening. Like, okay, a new chapter of life has opened for me. Or maybe somebody who slept and woke up in Pluto and doesn't. I don't know if you get it.
Yeah, I get what you're trying to say.
Did you see where the confidence came? The confidence came because I was around. And every now and then, I'm on my phone with him. If it's a procedure, I rush in and go and do it on behalf. Show him this how we do it. Oh, the last time I did it, this one, you are going to do it. You see how it is? Sometimes, I remember when he started, he was doing one rotation, urology. He did so much procedures. One time, he didn't do his procedures. So, around 7 there, the guy called me. I said, I'm coming because I was busy. Before I got time, it was almost late. And you have to do procedures for all those patients there. I was like, wow. And he has set up, everything is ready. And I was going about doing, and the interesting thing is that I didn't even do what you call urology rotation. But how did I get to know how to do it? Because I was in the surgical unit and everything, I go see. So I have to do everything with him. He's not going to be questioned that the work was not done. The work was done, one, because he got somebody who sacrificed for him. And knowing the kind of relationship I have with him, there's no way that I would have just watched him to suffer. And there's no way that I can say no to him. So every single time that he called me, I'll be around. I'll be available. I'll make myself available. If I have to give you instructions on phone, I give you when he does it perfectly. And it picks so fast. Right now, we are the same as if you ask me when the last time I saw him, I don't remember.
Yeah.
So the question is, what happened? He has found his way around.
Yeah.
You get it? This work, sometimes you can learn, but learning under intimidation is not a good way of learning. So if you don't make a good associate, you can get to a field where you know a lot of people, but because you don't associate with them, you realize that you'll be learning under duress, you'll be learning under intimidation, because the person is going to that. So you went to medical school this year and this simple thing,
what did you know it? You don't know anything.
The soul is already crushed before you even come into. You see how it is. So you make good friends. I mean, not only him, a lot of them that I got to know, they were in Karazin and we happen to be there. And you know, they know. So we help each other. We help each other. You get it? And this is how the work is. One time I was there, one guy from Venitsa called me, Charlie, have this locum here, because that time I've gotten some space, some extra work. You see how the extra work, and I was there, and the cool money just came like that. So if you actually want to,
you know why I'm laughing, but let's continue. You know why I'm laughing. Let's continue from the cool money. Yeah, the cool money.
Sorry, yeah, you see, the work, I keep saying this, the medical for the work is very interesting. You have a passion. The only fuel that drive the passion, at a point in time, you realize it's money.
Yeah.
It is money.
At the end of the day, though. At the end of the day.
I remember when
at the end of
you started working and the government is doing their this thing, the money is not coming and you are under stress and the work is stressful. I can bet you that almost everyone's stress has reduced since money started coming.
Yeah.
Yeah.
Definitely.
So that is how it is. It is full of connections. You see, some hospitals have very good allowance. Some hospitals have very low allowance. Yeah. You will know that they have a very low allowance because maybe you don't have friends who can connect you. Oh, Charlie, I want to go here. No. Charlie, this session, when you go here, they will give you this, they will give you that, they will give you that. Because you know people. So when you meet people, make good friends with them. Treat them well so that they don't pay you in terms of need.
Yeah.
Treat them well. You get it? You play so much wicked to your friends to the point that when they see you dying, they just walk and pass by. You see how it is? We have senior colleagues that we met whereby sometimes they'll just call me and be like, oh, are you free? Or I had this locum slot that I wanted to actually give them. I'm like, hey, I don't have time, but see money just passing. Someone is introducing you to money.
Yeah.
You see the thing? So I keep asking myself that, can I just finish with this thing and choose what I want to do with my life? Yeah.
Yeah, because after your house job, then you'll be able to be flexible as much.
A lot of seniors that we had a good relationship with them, and they are all over. They are all over.
Yeah, and to stress that, another thing is that, and if you have the skill, of course, because if you don't have skill, then there's no way people they will not even want to recommend you because, of course, you would go and do a bad job. So skill is also important.
That is it. Yeah, exactly. I remember one of my testimonies. I was there at work, and then someone called me. So I told him that he didn't call me. He WhatsApped me. So I was surprised he got my WhatsApp contact because it's so foreign. So I was surprised. And he said he got the number from a municipal hospital I went to work with. I said, okay. And he would like us to have a meeting. And from where he's coming to 37, it's almost like 9 hours.
Wow.
I told him, okay. So that time he scheduled the meeting to Tuesday. This man came, I mean, well-built, I mean, wealthy man, he came. And then we arranged the meeting with him, one nearby restaurant. I quickly took time there, we sat down. And the question he asked me that, what do I want to do after this? After my session, everything? Do you want to go into private practice? Do you want to go into, the government session? And I remember I told him that it depends, in the sense that I have the passion for what I'm doing, but the flow I need is money. I told him point blank. So in making that decision, I think it will depends on where I think it's very comfortable, money and my specialization. And the man said that he heard of me when I was in, is it 4th year? I think I came home in that same hospital. So he was literally looking a way to sponsor me. According to him, say he met my dad, and my dad told him that I'm okay. Not knowing the man was actually putting up a hospital. So he was thinking that he wanted to sponsor me when I finish. He would have me as his personal doctor because he is an accountant for one mining company. So I just told him that, oh, has he spoken to my dad? He said no. So the man sneaks, even though he knows my dad, sneaks to come and have a business meeting with me. We sat down, he asked me surgical, what I can do. I mentioned it to him and he was amazed. He said, wow, I've gotten a lot of MOs, but he said they can work with me, but they don't do surgeries. I said, wow, do you know what that means? It means that a house officer who has completed the 2 years and have no hands-on.
Wow.
You get them plenty. So when I told him that, I'm not done, not even with my first year, but I do this, I do that, I do hernia, I do this, I do this. The man was amazed. He said, wow, you are the one I'm looking for. I said, please, can you help me to help you? And he showed me the picture of his hospital, very ultramodern. setting up the theater. I went through. In fact, I was even making decisions. Saying that, okay, this one's supposed to be here. Do you have this? Said no. I write it for him. Do you have this? Said no. I said this thing make work easy. Do you have this? And I'm talking about this a lot of money. They're talking about it. But then I've become somebody who can also make decisions. And when I finished, I told him that we can start on this basis that when I'm on leave, I'll come and help him at his hospital. And then we will see if we can build a relationship from there. And when I'm done, I will decide. And so that's no problem. If we do this case, you have this person. I told the man that relax. The man just needs me just like that.
Wow.
You know, I'll give accommodation, I'll give you this. I said, you just relax. When I'm done,
I'll find out what I would love to do.
Who gave me my contact? I still don't even know.
Wow.
I still don't even know. He keeps messaging me. Have you been able to bring your leave forward? Because I told him that my leave will be around September. I'll be able to bring it forward. But I thought I can do something about it. But I'm not in a rush. I'm not in a rush for that. These things will chase you. I mean, they will chase after you if you are good, if you have the passion. Yes. But when it comes, you realize that, I mean, don't go to where you're going to stress. You'll be a doctor and you have something you call pocketitis. You know, your pocket is actually not speaking so much. It's not good. You see how it is?
Yeah.
It is a good relationship I built from that hospital, that municipal hospital. And as a working package, when I was leaving, when I told them that I have to go, you could see pains in people's eye. I said, oh, Dr. Eben is going. So Dr. Eben is going. Because they never had a doctor who comes to work at 6:30. The earliest they've gotten is 9. And when I come, I do ward rounds for every unit at that same hospital.
Wow.
I'm currently staying in a residential area, 3 separate bedroom apartments with a very big hall, a very big kitchen behind me that I've not even boiled water there before, alone.
You're not cooking jollof.
I don't cook jollof anymore.
I'm coming to Ghana and I'm coming to eat jollof rice. This thing you're saying.
You see, they rented it for me. It was part of the send-off package. You know, why? Because of a good working relationship with them, the passion and everything. Now let me just seal this. When we're in medical school and have opportunity to save, do it.
Save money, right?
Save money. I mean, it is a time, you see, you have to know yourself. For example, if you think, because this is where you meet people who are in need, you realize that when the same institution, but people are in need, maybe you may be like, you have to help this, you have to help that. That one is okay. That one is also, I mean, another calling from God. So why not? But if there's a way you can actually save it. Getting a first paid in Africa, it is not easy.
Yeah. Especially in Ghana, I think your system is like you have to wait a long time. Like you finish working before you get the money. Yeah.
I wait for 7 months before I got a salary.
Wow.
7 months before I got a salary. You see how it is. So if for somebody that the whole family just sponsoring you for you to finish, and you know Africa, the prestige is so much that even when we're in medical student, you have come home, we're a doctor.
Yeah, you're a doctor already now. Once you even enter medical school, that's it. You're a doctor already. Yeah.
And the expectation is so different. The expectation is so different. So make savings, something to move around. Writing your medical exams, everything comes with money.
Yeah.
Comes with so much burden. If care is not taken, you'll be a burden to the family. And woe unto you if you don't pass the first one.
Prophet Eben, woe unto you.
If you don't pass the first one.
Because you're on your own, and it's like, okay, what did you study when you went there? I get what you're saying. Yeah. You can't
even join them to watch television. I remember my own part was totally different.
It's Africa home, definitely. That's why you failed. You
Me, I
were
was
watching
working,
movie in medical
and I
school.
have to
That's
leave
why.
the work to go and study. I was working and thinking of this exam, thinking of this exam. I don't want to write. I want to write. I want to write. I want to write. So I wrote the exam same day by mistake, but I thank God I did because I have to go to Seychelles. I got my contract, everything, working on everything. I came to Accra and visited my only brother Henry, see how he studied for the exam. I was like, this exam I can also write it too, and that's how my mind just changed overnight. My parents were not happy about this because that's not our plan and all. But glory be to God, as we wrote the exam, COVID came, nobody could travel. So the time I was supposed to travel was actually caught in COVID time. And thank God that I had registered for the exam by then. My daddy was not happy. He said, okay, he's not going to pay for the exam registration. But come on, we started working when we came. So we catered for it.
And I want to still put in that point. You were able to work when you say comment because of experience. You had hands-on experience.
Yes, that is
it.
Because that is it. If you want to make yourself, normal, steady, and just come, trust me, no one is going to employ you. No one is going to employ you. Yes. Even at the time I was working at municipal hospital, I still have locum I was doing. No one is going to employ you. So build yourself so much. When you come, for example, I was talking to, one of my guys way back in Ukraine. He's there now studying. And I was telling him that it's been a while. And I was like, sometimes I want to call, but I keep pushing it. I said, no, for almost like getting to a year, I've not heard from you. I said, you never see importance of what we're doing. The disadvantage of what we're doing until you finish. You will never see it. So if you want to make, we want to actually enjoy brotherhood, a good friendship, benefit of it. Start now. Check up on us now. Let's communicate now. So that when you finish and then you need it,
it will be normal. It will be easy. It won't look as if you are calling me because you need something or information.
You see the thing?
Wow. Thank you so much.
We know what you have to learn. So just come in. And then we help you. So I think with this time, if I've taken time, forgive me. At least I've been able to touch one or two aspects of the most important things you actually have to know whilst in medical school. And then you still have the time. If I've not completed, it's never late. Start and then you'll finish. Maybe one or two things I do regret for not doing more. Yes. But I think on going forward, I'm still going to put up myself together to see if I can fill those holes that I actually left whilst I was in school.
Wow. I think this particular audio is worth listening to. You listen to it before you start first year, before you finish second year. I really wish, this is so good content for me. I really wish I had this to listen to, like in medical school. Put God first, because of course life is going to get busy. Get hands on, be involved, research, build good relationships with people, long and lasting, and save, improve your skills. These are really, like, if you could just put these things together and constantly build on it, I think it's going to be amazing. So thank you so much, Dr. Eben.
Thank you so much for having me.
There's too much wisdom, so I'm going to catch you again for another video.
I'll wait under yourself, sir.
Yeah, I'm going to catch you again for another video. So guys, leave a question for Dr. Eben in the comment section if you have. I would, if it's not there to answer, I would get the question, get to him, get the answer, and bring back to you. So thank you so much. He's doing so great. He was my trainer in Ukraine. I miss that he's not around. Going to gym then, and then he says he does not cook jollof again because he's a big boy. He has a big kitchen behind him. Right? That's what he is. He made videos that he doesn't cook jollof rice again. But I don't. I come to Ghana, I will see now. We use that kitchen and then cook. So thank you so much, sir. And please, guys, subscribe, like, share this video to all medical students. I think I'm going to put on this video a must watch for all medical students. So thank you so much, Eben. And until the next video, click the next link right here and get informed on your medical journey. So bye-bye.
Bye.